The president's prescription?
I want to see a bill with heart. Healthcare is a very complicated subject.
And his diagnosis of the acute political challenges around the Senate Republican healthcare bill.
You move it this way, and this group doesn't like it. You move it a little bit over here. You have a very narrow path. And honestly, nobody can be totally happy.
The dissatisfaction is palpable as several reluctant Republican senators want to pump the brakes.
I have a hard time believing Wisconsin constituents or even myself will have enough time to properly evaluate this.
It's hard for me to see the bill passing this week, but that's up to the majority leader.
Right now, I am undecided.
For Senate GOP leader Mitch McConnell and the Trump White House, the time crunch is a tool intended to compel Republicans to decide and deliver before the 4th of July fireworks go off. Tweaks and sweeteners to the proposal will likely come over the next few days, along with an official cost estimate. The proposed health insurance overhaul includes new rules regarding Medicaid that are already raising alarm bells. This year, under Obamacare, 31 states accepted expanded Medicaid funding, where the federal government pays for 90% of the public insurance plan for lower-income Americans. In 2020, the Senate GOP proposal would make states pay a larger share. By 2024, the federal government and states would split Medicaid costs. Conservatives defend that approach, claiming federal money will still be there.
It's never going to be cut. It's never going to shrink. It will eventually be growing at a slightly slower rate.
But if states can't afford to pay more, coverage cuts are inevitable.
The most vulnerable people in our society and healthcare providers, such as our rural hospitals and nursing home, most of whom are very dependent on the Medicaid programs.
And this is one instance where they are not trying to build suspense for some political theater. Insiders say they just can't predict how this will turn out. I'm told that key players are working tonight. They're looking at different variables like adding funding for the opioid epidemic or helping rural hospitals, preparing different kinds of provisions that might be needed to win over one last deciding vote. Kate?
Kelly O'Donnell at the White House.